My role at the Radiosurgery Center is I'm the co-medical director, and I'm one of 5 neurosurgeons that oversee and bring cases to the radiosurgery to perform stereotactic radiosurgery on the Gamma Knife unit that we have here. Here at the Radiosurgery Center, we predominantly treat tumors with the Gamma Knife technology, and the most common types of tumors in the brain are the most common things that we treat here, and that's metastatic tumors, tumors that have spread from other sources within the body. Here in the Peninsula of Virginia, that means that we're mostly treating lung cancers that have metastasized or spread to the brain, breast cancer patients. We also see patients with skin cancers, mostly melanomas, kidney cancers. So the big thing about the Gamma Knife is the precision that it offers. Almost every tumor is treatable with some form of radiation, but radiation over an indiscriminate amount of brain tissue is never good for the healthy parts of the brain. And the real thing that the Gamma Knife helps us to achieve is the ability to deliver radiation to only the prescribed areas that are abnormal in the doses that it takes for the radiation to be effective, and to limit the amount of radiation that goes to parts of the brain that don't need radiation. And so it's the precision that it brings to the treatment is what really makes it sort of better than all the other options. The margin of error for a Gamma Knife treatment is usually about 0.8 millimeters, which is more accurate than the best surgeon's hands in the world. So we're able to sort of deliver these treatments to these tumors even when they're adjacent to critical structures, and limit the toxicity, and still make the tumor that's sitting right next door go away or cease to be a problem. So in that regard, it offers the ability to do radiation treatments without a lot of the side effects that people had grown to sort of accept as part of radiation therapy. With the Icon unit, which we got back in April and brought on board, like I said, right about the beginning of the clampdown, we can now treat fairly sizable tumors, and because it only requires that the patient come in for a mask, it's easier than to come in one day, have the mask put on, it fits to the board here, get a treatment, go home, recuperate for a few days, come back, use the same mask, and do the same treatment. So essentially what the Icon has allowed us to do is to combine the benefits of the traditional way of doing radiation, which is small doses on multiple days with rest in between, with the precision of the Gamma Knife. And so we've been able to take tumors that previously we wouldn't have been able to treat except with either surgery or with conventional radiation, and treat them with Gamma Knife. I have a patient with